Welcome to Madcast. Here, we discuss the latest breakthroughs in healthcare, equipping you with knowledge that will enhance your health and well-being in day-to-day life. I am Dr. Wafaa Faysal. I am a consultant pediatrician in Dubai. Today, my guest is Professor Fawzi Safadi. He is a cardiothoracic surgeon, very well known, with more than 30 years of experience in his field. He holds a patent for the development of his innovative technique in artificial cord for mitral repair, the Safadi sliding stitch, along with holding a patent for the innovative instruments for minimally invasive mitral repair, the development of Dubai surgical set. He is an expert in the modified Kono procedure, Safadi simplified technique, and a very, very long list of achievements that are so great and numerous to mention. Professor Safadi is a winner of several awards during his illustrious career. He is a winner of the 21st Dubai Government Excellence Program in Innovation category, Dubai 2018. He is a winner of Fuel Our Pride Award, Innovation category, Dubai 2018. He is a winner of the Subramanian Innovation Award for the work certified new adjustable Dubai artificial cord for mitral repair innovation method. He is shortlisted in His Highness Sheikh Hamdan bin Mohammed Program for Smart Government Improvement Initiative. He is a member of the International Society of Minimally Invasive Cardiothoracic Surgery and a member of the European and French and Lebanese Society of Cardiovascular and Thoracic Surgery. In short, he is a shining star in the field of cardiothoracic surgery, and most importantly, he is contributing to humanity with this groundbreaking work he is doing. Dr. Fawzi, it is a tremendous honor for me to have you as a guest on this podcast.
Thank you, Dr. Wafaa, for your introduction. It's very warm. Thank you, really. And I am very happy and proud to be with you in this interview.
We are really proud of you all the way, and we are proud that you are with us today. I'm really proud personally. The idea of this podcast is also to make the people know that great professors like you exist, and what you are doing will go through. Maybe we don't have the big time to discuss everything, the great work you are doing, but at least we'll give some idea about it. So let me start by asking you about the beginnings. I'm always interested to know how great people start, because I think there's a role for our families, those who raise us, and how the decision came to choose a medical career. And tell us more about this.
First of all, we have to recognize that everything starts in family. Family is crucial for the success. I'm not telling that every experience will achieve to the success, but it is a continuous trial from the family to prepare their kids for the future. And from my side, if I remember, since I have less than 10 years, I was called doctor. I was called doctor by my mom, by my dad, everyone, all my family. It is like my destiny. I take this responsibility as a child. It is my responsibility is to be a doctor. It's not for me only, it's for my family. Especially we are very modest family, with very limited resources, and all the family concentrated their effort and their sacrifice to push me to go ahead with my career. This is the most important thing.
It's a collective dream.
It was like no hesitation. I know from the school that I had to be doctor. Then I did my medical school in Italy. It was an amazing experience. And then my specialty in France. It was a continuity of also very well training in France also. As Lebanese, Europe was very attractive for us in that time. Then I come back to Lebanon. I refused to stay in Europe for
forever.
And I preferred to come back to Lebanon. It is very difficult, but it was like a responsibility toward my family, toward my country, to come back and to contribute in the work. And since I know that success is not related only of location, it's related of effort and sacrifice and hard work. So come back to Lebanon. I worked for 20 years. I contribute in creating different centers in Lebanon, and we did a great job, alhamdulillah, in Lebanon with my colleagues. As also my brother Fadi, owner of restaurants, a chain of Safadi restaurant.
Safadi restaurants.
Yes. And the circumstance in Lebanon became a little bit difficult, so I decided to transfer to Dubai.
Which year was this?
In 2012. I started 2013 effectively. I started.
Like
And also it was
12
also
years or so?
a very, very wonderful adventure, a very wonderful opportunity. Because in UAE, I found the environment and the environment and the support from Dubai Health Authority that they give me all the means, all the possibility to stand out with my ideas. The ideas came spontaneously. It's like a gift. We cannot decide to do that. If I remember when I was in school, I was among the good to average students. Not
you're not the superstar in the class.
No.
Wow.
No, I was normal,
Yes.
regular student.
Yes.
Regular student.
It's very nice from you to say that, because they usually believe that those who study medicine should be top students.
No. I discovered that with my first exam in Italy. I get excellent and full score, and I was surprised by myself.
Yes.
How I get it.
Because this is what you are here for.
Yes,
This is what you like.
It was a stimulation to me to start, and I continued. And really, it was. I was majoring in all, career, my course in general medicine and in also in the specialty. It was a discovery. Sometimes we can discover ourselves.
Yes, through our life. Life is a journey of discovery of oneself.
And in the life, to be honest with you, we have some not. The life is not like a continuous plateau of success. We have some time, some deception, some difficulties, frustration. It is normal. It's not. And by the way, frustration can create a big person.
Yes.
Because if you are all the time relaxed and we have everything and very busy, so we don't have the motivation to go with innovation. Innovation sometimes comes from suffering. And also that, because the up and down condition in Lebanon pushed me all the time to see how we can do. My story with the innovation started with a deep observation. I am, with my humble word, I tell you that a good observer is the best innovator, because the observer, he doesn't need to start from scratch, from zero. He can observe, he can gather things, he can have some idea and build on what is here.
Yes.
We don't need to start from zero. So my advice is, don't underestimate any stupid idea. It doesn't exist, a stupid idea. Sorry for that. We can have some stupid behavior. I don't want to individual, but never a stupid idea. Because by stupid idea, we can develop it and we can correct it 1, 2, 3, and 10 times. And 100 times, then the stupid idea become a realistic idea and very beneficial idea. To my technique, how came? It came because we know it is written in the book that we have difficulties. As in the mitral valve, it is similar to the parachute. So we have cords and we have this tissue. Yes. Okay, the map, where the parachute can have this very slow shutdown, but on the system they have cord. The cord, they have same length. And when the pathology in the mitral repair, the regurgitation, when the valve is not functioning, it's open, it's not closing properly, because of excessive of tissue, and on the same time because of excess or cutting of this cord. In the both condition, we have to adjust the cord even with excessive tissue to regain the captation of the leaflets and to be effective. When we do the repair, the heart is arrested. By definition, the heart is arrested. So it means we need to define new cord in arrested heart when we hope that this length of new cord will be effective in beating heart. So how to match between
easy.
How we can expect that this length, decided length, it will be effective once the heart is beating again. So this
length was an issue for a long time.
Yes,
for 40 years, I think.
We have gap between.
They couldn't reach the proper length of this cord.
Yes, this is for 40 years. 40
years.
Different techniques.
Yes. And how did you do it? How could you find this?
I think that because all the previous techniques, based on the surgeon experience, and it was not a reproducible technique. It's not well coded, well defined, when everyone can do it. It's simple, it works all time. Simple ده can we apply instead to art artist surgeon, very talented surgeon to do it, and it was really mitral repair was really in hands of very very close number of doctors.
Yes.
No, not all doctors they can do it.
Yes.
And with Dubai technique now it is we can do this technique in everywhere.
Any setup.
Anywhere, no need to go for high center to do this technique.
Yes.
This is the point. And you have some referral points with expectation to have the good lens.
Yes.
Following a life transmission in Authority of Lebanon Hospital, one of the pioneer, one of the best in the world, Dr. Jibreen Khouri, in the presence of Dr. Obadia, also one of the the well-known and talented surgeon in this field. They did a live transmission, but still we are accepting grade 1 regurgitation. Still with that, they are happy with that.
Yes.
And I ask myself, how come we don't have a solution for this problem?
Yes.
How come we are accepting that? Because it is not ideal, but it is good. I'm not telling it is bad, but still it is good. It's not optimized, optimal.
Yeah, but we should not settle.
Yes.
For the good.
By looking to my colleagues, by my vision, go to the tie knot my colleagues. That's why we cannot do this cord with the simple mechanism of the tie knot, and we can adjust it until when we test the valve with this possibility, because creating in medicine it is suture. When we define the length of the cord, like you have scissor, and you can imagine you have cord, and you are cutting all the time this cord, and this length is okay, this length is not okay, this length is okay, because you are tying for 1 and 1 millimeter, 2 millimeter difference. It is very significant in mitral. We are talking about millimeters.
Yes.
Why we cannot do this cord like a loop, and with this loop we can do a knot, and we can slide it up and down.
Brilliant.
Really, up and down and you test the valve. And when we are really convinced and happy with the lens, we stop and we fix it definitely.
Yes.
But first, the first sliding stitch, by definition, this is an adjustable lens for the loop, and from there the idea came.
So you test it during the surgery?
No, we cannot test it. It is very we cannot shift to the clinical application by one time.
Yeah.
So for that, I start the idea. I created my own lab home.
Yes, in the house. Yes.
House, and I all my tools was handmade by myself.
By
because
yourself.
no institution, no organizations that can provide that. We don't have in the Middle East. Still, we don't have this kind of manufacturers that they can help doctors to realize their ideas. So I was obliged not only to promote this technique, but at the same time to create how to learn, how to teach it.
Yes.
To teach it, first of all, I have to teach myself.
Exactly.
So I have to train myself. I have to be sure that it is effective. It works.
Yes.
And for that, I created my own simulators. By the way, this simulator also can be very helpful for new surgeons. So when I worked on this simulator to develop the technique, also it can improve the skills.
Right.
So a new surgeon, a young surgeon, can have this simulator home, because it's not expensive at all. It's not commercialized and with colossal numbers, a very exaggerated budget. I did myself. It is
nothing can stop the talent. Nothing can stop a brilliant idea.
Yes, it is. And I enjoyed also that. Yes. I enjoyed to create, and it is like
very creator.
So I created the simulator and I started working on. And my wife and my kids sometimes helped me, because I need hands. It is like sometimes a duty for everyone to come and to have to leave their job and to come to help me. It is just a small detail that the family is really contributing
to the success. Yes.
Before reaching the level of independent, يعني very sophisticated simulator that I can walk alone. But in the beginning, it was a trials, يعني to reach
trials, yes. To know
different
how,
trials.
yeah.
Yes, it takes to me 2 years to define the final stage that it can work on.
Yes.
I did the different cases in Dubai.
And they were successful.
Very, very successful.
So when you do the surgery, just this question, you put your stitch, Safadi stitch, and then how you know that this is because it's a knot, there's a knot to adjust the length. Yeah, when the patient goes after how many months or
No,
days?
Immediately,
yes.
because we don't leave the surgery until we have control with the echo.
Oh.
So on the table.
Yeah, this was what I was
on
asking.
the table we can.
On the table you adjust the. Yes.
We do surgery and we start the heart and we do the echo, and I want to tell you, without exaggerating, it is the testimony of all my colleagues worldwide. It works always.
Yeah.
Always it works. Always because
it allows itself to adjust the length by itself.
Because يعني like يعني natural. It works. It works always. يعني how many times in live transmission we do the record and we cut it and we do again and again and again because we are not happy with this technique. One time is enough because the coaptation is reached for يعني very accurately.
Yes.
It is very accurate. It's very simple. So simple.
Yes.
So simple to apply. So simple to adjust. So simple to يعني.
And this makes it more successful because sometimes you have complicated solutions. No one can use them. Exactly.
You know, when
this is brilliant.
I was candidate for the best innovative technique in minimum invasive approach in Vancouver,
yes.
Canada, in the presence of 448 cardiac surgeons worldwide. They voted for the best technique. The best technique was not by committee.
Wow. Yes.
It was not a committee.
They're the surgeons themselves.
In the audience, they voted.
Yes.
It is not a question of panel.
Yeah, exactly.
The panel shortlisted, but the rest,
those who are there, those who are working.
Yes.
In their hands,
coming from all the school.
Yes.
In the competition, we have 3 from United States of America, from Switzerland, and from Dubai. And my technique was very simple. No industry, no very investment in milliards, like creating and people were attracted like, this time, no, we don't want to follow the big industry, the big, let us do this is so simple, so cheap, so with one suture we can resolve it. And it will be beneficial for how many patients. And my reward, my real the real reward is when I see this technique helping people, helping patients, getting things good,
improving their lives.
Patients have a good surgery. Yes. I'm telling you, because we should not be arrogant to consider ourselves the best in the world. Because a scientist is not. As a surgeon, I can find also better surgeon than me, more experience, more age, etc., exposed to high volume, etc. But science is different. When the scientist can offer to the good surgeon tools, it's a big satisfaction.
Yes.
It's a big satisfaction.
Right.
And when I see that
so you have both, I think. You are the surgeon, the great surgeon, and you are the scientist. So both two great things in one person.
But
we are really lucky to have you
in
the Arab world and for the whole world. This is a great help for all these patients who have this mitral valve regurg problem or any mitral valve disease, let's say.
I prefer to hear from you that I am the good surgeon, not
yes, you are very well known and everyone knows this.
Alhamdulillah.
And yes, your patients even talk about it. Your colleagues know it. So we are really honored to have you. And this is something inspiring. I mean, we have to say it because it's inspiring, because other generations of surgeons, cardiothoracic surgeons also will know, or any other doctor or surgeon, we know that we can do something. We can contribute. We should not settle that because we don't have the biggest labs and the biggest, let's say, whatever techniques possible for our ideas or whatever techniques we want to introduce. So still there is the individual himself and he can do it. So this is a big inspiration.
Alhamdulillah, I want to tell you something that I expected that. I'm not surprised, but how it spread, it was my wonderful.
In the US now they are using it in Miami and
Miami. It is only one center. There are thousands of cases in Miami, thousands. In Houston Method, it's the Baker Center. They are using this technique.
They are using this Safadi
And I walked
sliding stitch.
Yes.
This magical stitch. Safadi magical stitch, I can call it.
I go to United States, Houston, in Houston Methodist, the Baker Center, and I was the mentor there.
Yes.
Alhamdulillah.
What do they say to you? What do they tell you? I mean, how did you do it? And
Alhamdulillah, I go in the operating room of the Professor Michael Dabari.
yes.
And I mentored my technique. It is something, alhamdulillah, I'm very proud of that.
Yes.
And also in Europe, in Belgium, in France, in Italy, Professor Mattia Glauber, Professor Anfieri is in all the world. We have names attached to the mitral repair.
Yes.
Attached.
Yes.
It is the creator of
Yes,
it.
exactly.
Like the Carpentier, Anfieri, David Adams.
But all they say this is the father.
This is the father of this technique, and now the technique is in all these centers. All these centers.
I think you are the father of
Alhamdulillah,
the mitral valve now. You sit in that
Astaghfirullah.
position.
But I think mitral repair, it's become very easy, very simple, very fast to do, and it doesn't. And also the advantage of this technique that for doctors shifting for minimal invasive. With the open technique, the technique is easy to do. But also, if we go with the surgeon doing the surgery in like Dr. Din Yangmaz in Europe, he do the mitral in homes, not even incisions, in other, and in VATS technique, pure VATS technique. He is one of the few doctors in the world doing that, and he found Dubai technique the solution for his technique, because this became the secret of also one of the big advantage that like it is a sliding stage. The surgeon can apply the suture and go out with the two arms of the suture. He can create the suture outside of the body, outside of the chest.
Yes.
And then he can sliding by following the screen. He can slide it inside.
Yeah.
So you can imagine how
Yes, it's easy.
So the incision is not anymore important, because doing this it is very easy to create the stitch outside of the body, and with this simple maneuver of introduction inside, he can slide it even with the incision of 1 centimeter, 2 centimeter. He can, but the standard is 6 centimeter, which is very
acceptable still.
6-7 centimeters. This is everywhere in the world, like in America, etc. Because this guy doing that in 1 centimeter is something really very exceptional, and we have to recognize also.
And he's using it also. How did it spread to the whole world? The Dubai technique,
Safadi
sliding stitch. You traveled.
I traveled
to teach, to inform them about your idea.
You see, because I didn't put.
You published. Research on this? You published in any journals?
Yes, in innovation journal and in different. But the problem is when we discover something like that, the fourth is we need this exclusivity, and we have to profit for this exclusivity and asking people to be operated in our center. And we don't want to teach it. I did the opposite. I prefer to teach people, not to take care about what it can be beneficial to me. To bring people, because
this is
life
science.
is short. Life is short, and I want to tell you something. The volume of our patient in our small country is not like the volume in Europe.
Exactly.
I prefer to give this technique, to offer this technique, because to be honest, we are receiving too much also science and technology from them, and it is the time to listen to her, because the Professor Torina from Switzerland, one of the pioneers of the cardiac surgery, when he listened to me in one of the conference, Professor Calafiori and big names, he told me really this. One of my colleague from Iraq, he told, Ten, talk. He lost his control, he put the protocols, and the Fawzi talk. I talk, and then Professor Torina with some reflection in the presence, in the audience, respond that we don't have this habit to hear these things in this area.
Yes,
It was
unfortunately,
not he was honest,
yes.
but it was also hard,
Yes,
very
yes.
hard to
Yes.
that they consider that this science, it's by definition
should come from West.
them, and we don't,
And the
how
Western
come?
world, Europe and the US.
How come?
Yes, how come? But I think the United Arab Emirates has changed this idea for the whole world. It has proven that it is one of the leading countries in the whole world now. It created the environment for professors like you, for researchers, for innovators, for all those who have talents to show it to the world and to prove themselves. And yes, talents are existing here, and they are able to do great stuff in the UAE. So we need to thank this great country also. And it's one now of the most important countries, the leading countries in most of the aspects, in all aspects, if I can say.
Yeah, and of course, we are very lucky. We are very lucky to have this opportunity, and we are very honored by this support, because it is maybe I don't like to talk about too much persons, but really key person. Out of flights, they don't want any recognition, but many people in UAE contributed strongly in this show. Dr. Abdurrahman Jasmi, Mr. Hamid Al-Qutami, Dr. Khaldoun Nabhan. This is names that it has in my mind how they contribute, how they supported me to do that. Financially, morally, physically, everything. They opened the doors, and they opened all this and gave the opportunity, and also I was honored also.
Yes. Yeah, you were awarded. This is what I wanted to ask you.
Our ruler.
Many awards, but which is the one that means most to you?
I am proud of that I was awarded by our Ex-Highness, and also Sheikh Hamdan bin Mohammed was very interested.
Yes.
And I remember very well his how he looked to me. And he was happy, and I was very happy because he was happy.
Yes.
Alhamdulillah.
Exactly. Alhamdulillah. So what is, Professor Safadi, what is your message to the people? Because also those who are watching us and listening to this podcast, how can they reach this expertise, or your expertise and your colleagues' expertise, and these new techniques? I mean, they just go to those who are suffering from, let's say, mitral valve conditions.
I'm very happy to work in Faqih University Hospital. The setup is very advanced, really, in all this hospital. I contributed myself to create. I created this setup with this hospital. They put it all their possibilities to make this program successful.
Yes.
Thank you also for this.
Yes. And what about the other colleagues in Dubai, the cardiothoracic surgeons? Also, they are applying Safadi sliding technique. Or stitch.
In Dubai Technique, of course, they are doing that.
Dubai Technique,
in Dubai Hospital, they do.
Finally, I will ask you, what are the secrets of success? What are the secrets of innovation? If you can summarize this in 3 sentences or 3 words.
We have to be humble. We have to be very humble. And it's a gift. It means arrogance is the enemy of arrogance, because
the enemy of success, for sure.
The enemy of success,
for sure.
And to be patient, and to enjoy
what we do.
Exactly. And to give sense, the real sense of serving the humanity. Why this organization international is coming from abroad, and we are accepting these titles that they are the leader of the humanity, when the humanity is also native in us.
Well said.
This is very simple. Very simple.
Very simple, yes.
And spontaneous.
Exactly.
And
very well said.
The burden of the success is very harmful. When we forget the success will accompany us, and he will supporting us.
It will lift us. Yes.
Unless having on the back and this heavy weight.
Yeah. Exactly.
No, be normal.
Yes. It was truly an honor for me to interview you, Professor Fawzi Safadi. As a fellow Lebanese, I feel immense pride knowing that you not only bring honor to Lebanon, you bring honor to the entire Arab world and beyond. So I'll speak a little bit in Arabic. عن جد بنحس بفخر واعتزاز، ويمكن لأنه بحكي بالعربي هي لغتنا الأم. وأنت مصدر فخر وإلهام لكل الأطباء، زملائك الأطباء وزملائك الجراحين، ولأي إنسان مبدع.
شكرا كتير دكتورة وفاء على كلمتك الطيبة. بقول لك شغلة، أهم شيء الإنسان بهالحياة يترك أثر. هالأثر ما ضروري يكون مكتوب بالكتب، الأثر هو حضارة، تبقى بالحضارة بتتحول لناس، بتتحول لطريقة عيش. طبعاً. حتى لو النسل اسم صح. مش مهم صح. مش مهم بس يبقى أثر طيب بهالدنيا، لأنه ربنا ما بينسى. طبعا أكيد. تسلم تمك. Thank you very much. Thank you.